If you're experiencing headaches, muscle aches, fevers, or colds, going to your local pharmacy for acetaminophen can be a good place to start. However, this simple solution can come with some difficult questions. For example, is it safe to take over-the-counter acetaminophen if I'm taking prescription medications to manage other health issues? Is there a limit to how much acetaminophen I can take safely? If there is a limit, what side effects will I experience if I accidentally go over this limit? Let's work on answering these important questions. Acetaminophen is usually a safe drug, but is a component of many medications. Therefore, it is important to consider the number and type of other drugs you are taking before adding more acetaminophen to your list of medications. This is particularly important if you are a patient experiencing polypharmacy. Polypharmacy is defined as the use of multiple medications for one or more conditions. Commonly, multiple medications means taking 5 or more medications daily. Studies have shown that polypharmacy is increasingly common among older adults. The practice of polypharmacy can have severe and lasting effects on an individual's health. So let's learn more about acetaminophen in order to know how to take it safely. There are many over-the-counter medications that contain acetaminophen. One of the most common medications is Tylenol. This includes Tylenol PM, Tylenol Extra Strength, and Tylenol Arthritis. Take note, however, that each contains a different dosage, ranging from 325, 500, or 650 milligrams. Acetaminophen is often combined with other medications, such as in Dayquil, NyQuil, Midol, Theraflu, and medications for cold and flu, such as Robitussin Severe Cold and Flu and Alka-Seltzer Plus Cold and Flu. Common prescription drugs that contain acetaminophen are prescribed for pain and or headaches. These include Vicodin, Lortab, Percocet, and Fioricet. These also can vary in their acetaminophen content, so ask your healthcare provider any questions you may have.
The major side effect of having more than 3,000 milligrams of acetaminophen in one day is liver damage. This is made worse by drinking alcohol. Also be aware that combination drugs containing acetaminophen have their own possible side effects, such as drowsiness or upset stomach. An allergic reaction while taking any of these medications can also occur. Speak with your physician if you notice any of these side effects. Now that we know the recommended daily limit of acetaminophen, let's look at how we can safely keep track of our intake using information on drug labels. On over-the-counter drug labels, the amount of acetaminophen is listed under the active ingredient heading. Although the print on drug labels is small, this information is often highlighted, making it easier to find. On prescription drug labels, the list of active ingredients, including acetaminophen, will often be listed under the Each Tablet Contains heading. Once you locate the acetaminophen amount on each drug you are taking, you can add up the amounts to ensure that you are staying below the recommended limit. Remember, different medications have different amounts of acetaminophen, and common amounts are 500 milligrams, 300 milligrams, 325 milligrams, or 600 milligrams. By keeping track of acetaminophen amounts in your medications, you can ensure that you are staying safe and healthy. Acetaminophen is safe when taking the recommended dose. However, be aware that many over-the-counter and prescription medications contain acetaminophen, which may be harmful when taken over the maximum 3,000 milligram recommended dosage. Patients should talk to their healthcare provider or pharmacist to discuss their current medications and to gain more information regarding maximum dosage or polypharmacy. Thank you.